my name is Tamara Holness, and I'm doing a medication administration with the IV, um, doing an IV administration for Professor Moore's 105 class. Let's begin. Um, all right. So the first thing I'm gonna do, right, is I'm gonna practice hand hygiene. Okay. And I have all my supplies here. This is the arm, the IV bag, and the tubing. So the first thing I would do is I have my supplies. I'm going to go to the MAR, right? And in the MAR, it says that the patient is to receive 125 mLs of solution per hour. I calculated it. That comes out to 21 drops per minute. The patient doesn't have any allergies, and then I'm going to begin. So the first thing I'm going to do, I did the hand hygiene. I have all my supplies, and I'm going to go in the room and provide privacy. So I'm pulling the door. Knock, knock. My patient's name is Ellen Davis. Hi, Ellen. My name is Tamara. I'm one of the nurses here. I'm going to be starting an IV for you, okay? I see you already have an IV. The port is already there. I'm just going to start it now. I'm going to hang an IV. Is that okay? She states that it's okay. Again, she's going to receive 125 milliliters per hour, which equates to 21 drops per minute, as I calculated it here. All right, so let me begin. So I'm looking at my bag, my IV. The bag, I'm looking at it, is not expired. This is 0.9% of sodium chloride in this bag. It's not expired. Then I have my connection tubing. I'm going to remove the bag. And out of bag. And the port. I'm going to look at the solution. Solution is clear. That's fine. Okay. Alright, after I remove the bag, the concentration, this is 500 mLs of 0.9 sodium chloride. And then the dosage I'm going to give again 21 drops per minute. And again, I'm verifying again. 5 milliliters, 0.9. I'm looking at my MAR. And it's 125 mLs. So I'm doing it again. 500 milliliters of sodium chloride. 125, 21 drops per minute. Okay. And that's fine. So now I'm going to identify the patient. Hi, can you give me your name and date of birth? She states that her name is Ellen Davis, and the date of birth is 9/19/75. Okay, so I have my right patient. I'm looking at my MAR. Everything is correct there. I have the right patient. All right. So now I'm going to Alright, sorry. So the first thing I'm going to do is I'm going to put Dawn on my gloves. After I did hand hygiene. Dawn in my gloves. Opening up my package. And then my roller clip. At this point, I'm using the aseptic technique. So I'm unwrapping this. Taking this out. So now I have my spike and my clamp. So I'm going to close my clamp at my spike. Right, and again, aseptic technique. I'm going to have it upside down in my non-dominant hand. Right, and I'm going to pull the tube off the port. Then I'm pulling the cap off the spike. I'm going to twist this in really, really well so it gets in. Okay, it's in. So now squeeze this tube until it reaches to midline, which is right there. Okay. Now I'm gonna prime my bag. All right, take the cap off. And now I'm gonna prime my bag to make sure that I don't have any air bubbles. So I'm gonna unclamp it now. See the liquid is going through. All right. Go through just a little bit. Get all the air bubbles out. All right. It is. My line is primed. There's no air bubbles visible. I'm going to hang my IV bag here. Okay. I'm going to attach a label. When I started, it's going to be done in 72 hours. I'm going to attach a label to the tubing. I don't know if you can see this. Oh, yeah, you can see it. But I'm attaching this label to state when it's supposed to change. The IV bag is supposed to change to the tubing. Okay. Now, my IV line. I'm going to prime it a little bit more because I see little air bubbles there. Okay. So officially now my line is primed. I'm going to attach this piece to the patient's arm. How are you doing? Her name, sorry, her name is Miss Davis. How are you doing? You feeling okay? I'm just gonna look at your IV site. Make sure there's no swelling, warmth, tenderness. All right, I'm connecting your IV to your IV port. She said she states she's okay. IV site, and that is, now I'm gonna just do my drops. It's supposed to be 21, what is it? Yeah, 21 drops per hour. Okay, so it's dropping at 21 drops per hour. My patient as well. She says she has no pain, no redness, no swelling. She has no discomfort. My IV line is dropping at 21 drops per minute. I did, this is the right patient, right route, right, compare my MAR, right medication, 0.9 sodium chloride, right time. It is the right time that the order was set on from the MAR, and the route is IV. And that's it. That's how you start your IV medication line.